afternoon. It's Dr. Chudi Ufondu of Inspirations Global Health Solutions. It's yet another wonderful day. Today is the second day of September 2021, and it's once again our Lunchtime Open Clinic. Today it's a wonderful day for so many reasons. The first reason why today is a wonderful day is because you can still see me, you can still hear me. Every day above ground is a blessed day. So if you're still standing, if you still have the ability to complain, if you still have the ability to have people that will listen to you, to have a platform, to still have your family, to still have your friends, to still have a job, to still have money, to still have data. If you can see me right now, if you can hear me right now, you are blessed. I want you to do one simple thing before I start my clinic today. Can you place your hand below your left breast? I want everybody listening to me to just do that. Very simple exercise. So when you come in, it's my lunchtime open clinic. It's going to last for 30 minutes. And I'm going to take care of your questions and hopefully guide you towards making a better decision. But I want us to take a moment and just observe something. So if you can hear my voice, when you come in, let me know who you are. So introduce yourself, tell me where you're located, follow my admin, then keep your questions ready. But I want us to do a very simple exercise. So place your hand. If you can do this, just quickly tell the admin. So I want us to take a quick stock. It's a very practical step. So place your right hand below your left breast, below. Okay, have you done that? If you can do that, let me know. Just say, hey, doc, I'm doing it. I just want us to check something. So if you can do that, just place your right hand below your left breast. Okay? Now, what can you feel? You can feel your heartbeat, right? Now, that's the apex of your heart. If you can feel your heartbeat, you're blessed. Every day above ground is a blessed day. So thank you so much for coming this afternoon. Now, in our group, we have a huge celebration today. Our provider, Dr. Chudi, who has done amazing, exceedingly beautiful things, helping our community to know better. Today is our special day. So we are having a special celebration in our group today. So can we have a moment and reach out to Dr. Chudi and thank her for everything she's done for the community? She's shown every day. She's in her best without asking for anything. She's taught our members on so many levels to know their body better. This lady is amazing. So let's all appreciate Dr. Chudi. If you look at her, the last time I saw her was in 2007 before I left. She still looks like she's 16. It's because of the kind of person she is. She brings everything and she gives everything. She doesn't let anything on the table go without being approached. So thank you so much, Dr. Chudi, for everything you've done for SGHS. We appreciate you. We love you. We care for you. And we pray that today, as you're celebrating your birthday, God is going to do a wonderful thing in your life. God is going to bless you. You will never know any lack. You will have prosperity. You will have life. You will have more so you can be more to people. So thank you so much as you celebrate your birthday today. God bless you for everything you've done for our community. Thank you so much for what you're going to do further. Thank you so much for bringing out your time to help strangers, people you don't even know. Thank you for being the light in the dark world of maternal health. Thank you for helping so many women to become pregnant. Thank you for being the joy, in so many ways. We appreciate you a lot. So guys, can we all take a moment and give Dr. Chudi a special shout and love? If you have our contact, if she's your friend, make sure you reach out to her and send us some lovely birthday message. When you're done with that, we're going to quick start the clinic. Now, today is the 2nd of September. September is review month because September is the first month in the Ember months. Now, by September, you would have had a game plan. It's the 9th month. Now, it takes 9 months to conceive and have a baby. So if you were pregnant in January, by now you should have had your baby, or you will be getting ready to have your baby. So it's 9 months of taking stock. Now for 2021, have you taken stock? Have you taken time to see the direction you're going? Are you in the right direction? Or are you going the wrong way? It's never late to retrace your steps and do the right things. You see, greater percentage of our members want to start their families. And I also want you to start your family. I want you to be a mother. I want to be a father. I want you to feel the joy I feel every single day I wake up. And I know I have 2 kids I'm responsible for. It gives me special joy. So I understand you want this too. But the question is, are you in the right direction? You see, one of the biggest inventions in life is GPS. Prior to GPS, I remember when I came to America newly, you have to map quest. Hold your map and you plot while you're driving. But with the advent of GPS, it made a lot of things easy. With GPS, you can know exactly the direction you're going, and you can know if you're getting there before or after. Now, if you happen to meet any roadblock, your GPS will recalculate for you. This is exactly the same thing that happens when you want to start your family. So have we identified the problem? What exactly is causing the delay? Is it coming from you? Is it coming from your man? Is it primary? Is it secondary? What exactly is the problem? Now, do you have a specialist attached to you? What are you doing about it? Besides praying, besides making love, are you following up with a specialist? So I want you to take that stock for the month of September. The reason why I'm saying this is very simple. Before you blink, it's 31st December. 31st December, it's more like an epiphany. You begin to look at things you could have done differently. You begin to live your life in regrets. Never regret life. There is absolutely nothing to regret in life. Life is all about lessons. Good, bad, ugly. It's okay. There are some days you will feel good. It's okay. There are some days you feel that it's okay. There are some days you feel like it's okay. But there are some days you look infertility eyeball to eyeball and tell infertility, you cannot stop me. This is who I want you to be. If you are not tough, you won't be a mother. If you are not tough, you won't be a father. Infertility is going to challenge you, but you're going to overcome. So I want to encourage you today to renew your efforts, to renew your commitment. So many people already have a plan way. So many people, they've already told you what the problem is. Probably they told you need IVF, you need IUI, you need fertility treatment, but you're still trying to. You see, one of the biggest thing you can do for yourself is to think you don't have a problem. Meanwhile, you have a problem. So accept your reality. Agree you can take up the responsibility. Then start having plans. You see, when you have plans and you execute the plans, it's completely nonsense. So when you are planning to, so many people have been planning to, they are still in the planning to phase. Graduate from your planning to doing phase. Before you blink, the year is going to end. Okay? So thank you for coming this afternoon. My admin is going to make you comfortable, and I'm going to take care of your questions. If your questions were not answered yesterday, I apologize. And after today, after my clinic today, make sure you join Dr. Chudi. You don't want to miss this particular clinic because it's our special birthday clinic. So make sure you join Keeping It Real with Dr. Chudi on top of the hour, 6 p.m. Nigerian time. And you will be blessed by her lessons. Okay, so let's go. Let's see what we have. Ask your questions once you come in. Begin to ask your questions. If you need to, reach out to me for 1 week, for 1 month, for 3 months, for 6 months. It's possible. Now, something amazing is happening just in few days' time. Our long-awaited website will be ready. Our website will make our services very easy. You see, when you have your website, whether Facebook is down or up, it doesn't really matter because you can always go there and get all the services you need. So we are so excited about our website, and we can't wait to launch the website to make life easy for you in regards to getting your care. Okay, guys, let's talk. Ask your question. The clinic is now open. It's my lunchtime clinic. I'm spending the first 30 minutes of my lunch with you guys. So it's an opportunity to get feedbacks. If you don't have money to get services, my open clinic is an opportunity for you to get free consult. So my open clinic is normally designed for people that might not be able to come in for 1 week. to come in for 1 month, to come in for 3 months, to come in for 6 months. Please, I have a special message for all pregnant women. You see, pregnancy is a journey that if you blink is all over. Now, a journey of 9 months can have a lot of hiccups. When you become pregnant, you are your baby's biggest advocate. And one of the biggest insurance you can give your baby is to do what? To register for ANC. When you register for ANC, we are keeping an eye on you. We are keeping an eye on your baby, and we're making sure you're good and your baby is. If we discover anything that might be wrong, we'll start early. Unfortunately, in the past, we had women that lost their pregnancy. A pregnancy they should have had, maybe because of lifestyle, maybe because of lack of knowledge, maybe you were bleeding, maybe water was coming out of your body, and you were waiting for daybreak without knowing you're supposed to go to the clinic immediately. Please register for your ANC. It doesn't matter your trimester. First trimester, second trimester, third trimester. Please come to be in our SGHS lounge in Telegram. Now, when you have registered for the lounge, I will also encourage you to register earlier in your own community, in your own location. You need a doctor that will see you one-on-one and make sure that everything is going good, okay? All right, guys, where are the questions? Remember, it's open clinic. I don't have a particular question. I'm just going to wait for your question. Then I'll start providing you feedback. If you need to register for our ANC, admin is going to set you up. All right, let's see. The first question says, Doc, please, when can a woman start trying for a baby after miscarriage? This is a very important question. Now, what you need to do, my sister, first of all, you have to recover. Recovery is key when you've had miscarriage. Miscarriage is the unintended loss of your pregnancy before 20 weeks. When you lose your pregnancy beyond 20 weeks, it's called stillbirth. So stillbirth and miscarriage are brothers and sisters. Now, when you've had miscarriage, it's one of the worst experiences anybody can have. It kills you. I've been there before. You know, it's like your heart was removed from your chest. Okay, that's how you feel. Now, when you lose your baby lives with you forever. No baby can replace the baby you've lost. Now, it's okay to cry. It's okay to blame yourself. It's okay to blame the doctor. It's okay to blame your partner. It's okay to be depressed. It's okay to be in denial. You can do all this within 8 hours. Once done crying and doing all this, pick up yourself, book appointment, go back to your doctor. We have to confirm you've had complete miscarriage. When you don't have complete miscarriage, it can also be a problem. So some women might have incomplete miscarriage. So one of the important things we have to do for all women that have had miscarriage is to do what? To run an ultrasound. We want to make sure that your womb is completely empty. Unfortunately, some women might have miscarriage, but it might be incomplete miscarriage. If you happen to be in this category, 3 things. You can expel the remnants of your baby by yourself. It's called expectant management. Or we can give you some drugs to aid in expelling the parts of your baby's body in your body. Now, when you have parts of your baby in your womb, it's called retained product of conception. You see, that your baby you love so much, when your baby is dead and is inside your belly, your baby can damage a lot of things in your body. And if care is not taken, you might not be able to become pregnant again. So we can allow you to pass it out, or we can give you some drugs, or you can go for evacuation. Now, some women can start with just the normal management of allowing you to pass it out. Then we check again. If you're not able to pass it out, then we give you drugs. Now, unfortunately, some women will wait for them to pass it out. They might not be able to pass it out. We give them some drugs, and they might still have remnants. Then we go for what? Evacuation. Now, when we have done evacuation and we confirm that your womb is clean, then you need to recover. You need to embark on recovery. Your recovery can come in different planes: emotional recovery, psychological recovery, physical recovery. It's not unusual to spot, to bleed, to have pain when you've had miscarriage. Your body is trying to adjust. When you have recovered physically, that means either you expel the parts of the baby by yourself, you use drugs, or you had evacuation. Once you have recovered from the physical part of your miscarriage, then you have to embark on emotional and psychological recovery. This is where so many women get it wrong. You are much in a hurry to go and become pregnant again. Now, we need to know why you had your baby gone. So we need to investigate. So when you go back to the doctor, there are so many things we're going to do. We're going to ask you questions. We're going to collect your blood. We're going to look into your body. We're going to see things we can do differently. Some women might have infection. Some women might have hormonal issues. Some women might have what we call cervical incompetence. When your cervix is not competent, that means no baby can stay in your womb. Anytime you're pregnant, your cervix will open and you will lose your baby before 37 weeks. So based on what we discover, once we fix it and your provider assesses you and feels that you are emotionally and psychologically ready, then you start trying. Some people, it can be 2 months. Some people, it can be 3 months. Some people, it can be 6 months. And some people, it can be 1 year. Now, the difference is your age. Let me tell you why. If you are 40 and you had miscarriage, a couple of things are happening. By 40, the quality and the quantity of your eggs are reducing. So we are running against time. So you might not necessarily need to have a longer period. What we need to do if you have miscarriage at 40 is to make sure you're fully recovered, make sure you don't have any remnants of your baby in your belly, then we start trying again. Do you know why? Because at 40, your fertility is reducing. The quality and the quantity of your eggs are reducing. So we're not going to waste a lot of time. But if you're 25 and you had miscarriage, we can afford to spend 6 months. We can even afford to spend 1 year so that your body will recover. So the key word is your age. Age is the most important factor in the life of a woman in regards to being a mother. The older you get, the more difficult it becomes. But guess what? God has a sense of humor. So in as much as it will be difficult for you to become pregnant at 35, above 35, you can have the ability to have more than one. So elderly women, women of advanced maternal age can have twins, triplets, quadruplets, way more than younger women. So in as much as your eggs are being reduced, both in the quality and quantity, some of those eggs can divide or they can be released in two. So when 2 eggs are released and 2 sperm fertilized, then you have non-identical twins. But 1 egg fertilized and divides, you have identical twins. These are important things you have to be conversant with. So my sister, when you've had miscarriage, piggyback to your doctor. Let your doctor be the person that will guide you on the best time to go back and try again, okay? Make sure you recover properly. Very, very important. Guys, remember, it's my lunchtime. I don't have a particular topic. I'm just providing feedbacks. So keep asking your questions. Okay, this is an interesting one. Please, doc, does antibiotics intake during ovulation reduce the chance of getting pregnant? No, my sister. Now, antibiotics intake must be under the care of a doctor, a qualified doctor. So you don't walk yourself up to a counter of a chemist and buy antibiotics. There are so many antibiotics. There are things we call sensitivity tests. So your body might respond to a particular antibiotics favorably or unfavorably. So what you need, if you have any symptom, don't be the doctor. Go to a doctor. A normal doctor will ask you questions, examine you, send you to the lab. When we tie the questions we asked you with examination and the lab, we come out with what we call diagnosis. Now, if you have an infection and it's a bacterial infection, we give you specific antibiotics. Now, your antibiotics, if it's specified for a particular infection you have, it will only work on that particular infection. The antibiotics can also have side effect or adverse effect. But on its own merit, antibiotics does not have any effect on your pregnancy. But this is what you need to be mindful of. There are some people that will abuse antibiotics. Then over time, you have what we call resistance. When you have resistance, when you have an infection, and we give you that particular antibiotics, it's not going to work. Now, there are 2 infections you need to be careful about. You need to be worried about if you want to be a mother. Chlamydia and gonorrhea. They are the 2 infections that can directly or indirectly stop you from becoming pregnant, not your staph. There is no relationship between your staph aureus and your pregnancy. There is no relationship between Candida albicans and your pregnancy. They are not at all important in your pregnancy. The one you should be careful about is chlamydia and gonorrhea. Both of them are sexually transmitted infections, and they are completely treatable. The key word in treating chlamydia and gonorrhea is time of diagnosis. With a 1-week intensive antibiotics, we can completely take care of chlamydia and completely take care of gonorrhea. But if we don't take care of them, they can be in your body and damage your tubes. So you might pick gonorrhea or chlamydia in your 20s, and because of fear, you didn't go for treatment. They might be on vacation in your tube. Now, when you marry in your 30s and you want to start having a baby, you discover you're having problems. Now we go to check your tubes through HSG. We discover that your tubes are damaged because of gonorrhea and chlamydia you had in your 20s. So what you do in your 20s, what you did when you were growing up, can affect you in the future. Let me give you another example. You see, your mother will not teach you how to make love, right? Of course, your dad will not teach you. Now, for 99% of us in this clinic today, we learned about love making by ourselves from our peer people. You know, by default, you're going to like people. You're going to fall in love. You're going to see people you have sexual interest in. It's normal. Matter of fact, if you don't have sexual interest in anybody, you better call a doctor and go for treatment because you're not well. It is okay to see people and you want to make love to them. But the key word is integrity, monogamous relationship. So it's okay to be attracted to people, but you need to be wise. So what we need to teach our younger ones is not, oh, if somebody touches you, they're going to become pregnant. It's sexual responsibility. When they begin to have sex, are they having safe sex? So if you are old enough to engage in lovemaking, be careful to look out for symptoms that might tell you have infection. Or be careful so that you won't become pregnant in the first place. So there are two components of safe sex: ability to prevent pregnancy and ability to prevent sexually transmitted infection. A wise lady with experience. Of course, you have to acquire experience of lovemaking. Unfortunately, there are so many people that don't know how to make love because nobody taught you. I recently had a client. She was actually worried. She's based in the Arab nation. She was worried that the partner is putting the penis inside the anus. People like that. Some women don't know that they have two openings in the vagina. You have where urine is coming out, then you have where the baby and blood is coming out. So go and find out how you can do this. If you don't know how to make love, go and learn. Nobody else will teach you except you and your partner. Learn, watch videos, do research, just do it because nobody's going to do it for you. And remember, if you're looking for a baby, you need to be making love 48 hourly. So the key word is safe sex. So if you don't want to pick sexually transmitted infection, the only one that will prevent you from picking sexually transmitted infection is what? Condoms. Proper use of condoms. So condom can prevent pregnancy and at the same time prevent sexually transmitted infection. So if you are growing up and you were wise and you prevented pregnancy and you prevented STDs, or you even had, STD, but you treated it properly, then you might have a chance. But if you didn't know you had STD, if you didn't know you had gonorrhea and it damaged your tubes, before you know it, 20 years, 10 years, 15 years down the lane, it will stop you from becoming pregnant. You are not becoming pregnant, not because you don't have your eggs. You have your eggs, but your tubes are damaged. So you need to know. Now, if you are old enough and matured enough, make love. If you notice discharge, if you notice pain, if you notice itching, if you notice something that gives you a sign that your vagina is sick, please go to a doctor. There is nothing you can hide from us. If you come in and you have vaginal discharge, doctor, I have vaginal discharge. Doctor, my vagina is itching me. The same thing is applicable to men. Some women are having problems today because they were shy, because they were not able to communicate. We are talking about starting your family. So empower yourself. What we teach you in this group are basic things: knowledge of your ovulation, knowledge of your fertility window, knowledge of how you can prevent pregnancy, knowledge of how you can have pregnancy, knowledge of when to begin to seek help. If you know the simple things, you will become a mother. The problem is not the big things. The reason why so many women are not pregnant today is because of lack of knowledge. If we had started SGHS in the 90s, 80% of women that are having infertility in this group not have infertility because it's knowledge. If you know what you know today, 10 years ago, you'll be a grandmother. That's a fact. So teach your kids, upcoming kids, Start early as 6, to teach them about sex education. Tailor the message according to their age. Begin to share all these things. My people, there is nothing to hide again. Whether you tell them or not, they're going to learn. They are out there in social media. They are out there in the internet. They know better than us. So we need to have that conversation. The earlier we have the conversation, the better. Okay, so let's continue. Okay. Can one who is 5 weeks pregnant take malaria drug? Okay. Okay. Now, 5 weeks pregnancy. Matter of fact, it will be difficult for someone that is not in the medical field to even pinpoint 5 weeks pregnancy. 5 weeks pregnancy is too early. Most women, by the time they know they are pregnant, they would have been in 6 weeks or 7 weeks or even going to 10 weeks. Why? Because your pregnancy starts from your last menstrual period. So I don't know the criteria you used in arriving at 5 weeks. But here's the deal. So long as you're consulting a doctor, a qualified doctor, and he gives you a specific antibiotics, a specific anti-malaria for specific first trimester, second trimester, third trimester, take it. There are anti-malaria you don't take in first trimester. There are anti-malaria you don't take in second trimester. There are anti-malaria you don't take in third trimester. So it's important. What you need to do, my sister, once you are confirmed pregnant, you are a different kind of beast. You are a beast. Like, when I mean a beast, I'm using it in a good way. You know, a beast can go to any length to destroy things. You protect your baby. So you begin to do things differently. The number one thing you will do once you get your urine test positive, when you're done rejoicing, ring your doctor, go for blood test. When they are done doing the blood test, arrange for your ultrasound. Ultrasound is the clinical evidence pregnant. Once ultrasound has confirmed that that pregnancy is developing inside the womb, you are clinically confirmed pregnant. The next thing to do is to look for a doctor to register for ANC immediately. This is applicable especially to my Nigerian women. My sister, if you are currently pregnant, Nigerian doctors are on strike. Some doctors are leaving the country. I don't blame them. Now, you cannot have an excuse that because the government hospital is on strike, you couldn't go for your ANC, or you were in labor and you couldn't deliver. We cannot take that. So go and register in a private clinic. If you have to borrow money, go and borrow money. Fertility treatment, pregnancy, they are expensive. Starting your family is not cheap. So please, if the hospital you're currently using is on strike, if the doors are on strike, don't be left alone with only the ancillary workers. Make sure that when you are pregnant, a qualified obstetrician is who you're consulting with. So please, transition from government hospital to private hospital. If you have to borrow money, please borrow money. If you have to sell your car, please sell your car. If you have to move into face me, I face you, please go into face me, I face you. Your baby's life is bigger than anything. Look, I know why I'm saying this. You know, if you can have money to show up in Facebook and put data, you can have money to register for your ANC. Please, I'm practically begging you. It would break my heart if I hear that a baby died because of lack of ANC. And we have had that severally. We have had women that lost their pregnancy at 40 weeks, 38 weeks, 32 weeks, 37 weeks. My people, let me tell you the frank truth. My daughter Zara was born at 26 weeks. If I wasn't living in America, I wouldn't be a dad today. So no woman should lose her baby because of care. It doesn't make sense. And my people, when you're pregnant, there are so many things you don't know. You know, some women will be pregnant and they are spotting or bleeding. And they will remember that their friend told them that when they were pregnant, they were having their menses. There is no such thing like having your menses when you're pregnant. Any blood you see in pregnancy is abnormal until proven otherwise. So I'm talking to pregnant women especially because this is my area of specialty. I'm a maternal and child health specialist. That means I love babies and I love the mothers. This is what I went to school for. So please help me protect the babies. Prior to now, we hear stories of women that died during childbirth, women that died during myomectomy. Simple things that shouldn't kill people. So be careful. If you're in Nigeria, make sure you're doing the right thing. Take all your A and C drugs. If you are in your second trimester, be careful. If you are in your third trimester, you should have packed your bags. Every woman in their third trimester can easily go into labor anytime. So you should have a game plan. You should have someone that will drive you to the hospital. You should have a partner. You should not be alone. You should be careful because your baby will come like a thief in the night. Your labor will come like a thief in the night. It can come by 1 a.m. It can come by 2 a.m. It can come in the middle of the afternoon. It doesn't matter. You need to go to the hospital. We cannot afford to lose any of our babies. We have lost enough. We cannot afford to lose any of our pregnant women. No. A good family, a pregnancy is considered completely done by the time we deliver the placenta and the baby is crying and pink and the baby is on the belly of the mother breastfeeding and the father is out there rejoicing. That's when we can throw our chest up and say, God, thank you for giving us good delivery. A baby deserves the mother. A mother deserves the baby. A father deserves the baby. And the baby deserves the father. The four of them should be alive. Nobody should lose their pregnancy. Nobody should lose their wife. Nobody should lose their husband. And the babies also need siblings. So if you are planning to just think you're going to have one baby, you're joking. You need a twin. Sorry, you need a sister. You need a brother. This is how God structured our life. But we are going to have challenges because we're in the world. But what do you do when you have challenges? You run to God, the ultimate finisher of our faith. We believe in God in this group. We pray every day. We make love every 48 hours. Then we go to see our doctor. This is how we roll in this group. So thank you so much for coming to my clinic this afternoon. Please, if you need help, we can help you. If you are thinking of what you need to do in September, remember, when you're done with September, you go to October, November, December. My people, it's game over. This is half time. If you don't have a game plan, if you don't know if you have primary infertility, secondary infertility, tune in this afternoon by 7 p.m. my time. I'm going to talk about the difference between primary and secondary infertility. You need to know what the problem is. You need to have someone that will help you. Some women will need help. Some men will need help. Some people cannot become without help. Some people might become with fertility treatment, with IUI, with IVF, with surrogacy, with adoption. Whichever one that works for you, figure it out on time, especially if you are above 35. My sister, listen to me. If you are looking for a baby and you are above 35 and you have been looking for this baby for 6 months, my sister, at the expiration of the 6 months, it's late. If he has to cause quarrel in your home, let it cause quarrel. The only time I sanction couples fighting is about babies. Query your partner, fight, argue, make sure you have enough resources to go for help. Some women, their partner will tell them, don't worry, we believe in God. God is going to do it. Meanwhile, you're 45 and your partner is 50 and you think you're on the same page. You are not on the same page. At 45 and 50, you have a big disadvantage because at 45, the chances are that you've gone into menopause. So men have saying this, but you might not understand it. So have a family meeting. Have a game plan. If you are planning to go to Nigeria and you're still dilly-dallying, Nigeria is cheaper for anything infertility. IVF is cheap. IUI is cheap. Surrogacy is cheap. Adoption is cheap. Very cheap compared to other places. If you have to go to Nigeria to start your family, go. We can help you. Now, some people will not even read the subscription link. They will start complaining. We have different categories. We understand that all hands are not equal. So some people can only afford 1 week. Come in for 1 week, sister. There are so many gains when you come in for 1 week. You will interact with me. We will figure things out. I will review your report. Then I will refer you. You will begin your journey. Some people are not able to become parents today because they are not going to the right place. Now, when you come in for 1 week, there is absolutely no way you will live the same. You can come in for 1 month, better. Or you can come in for 3 months, best. Or 6 months. Come on. Just come as you are. Take time and find out where you belong to. Go to that category. Go to that package. Sign up today. If you are pregnant, don't allow today end before you go and register. You cannot deposit excuse. You cannot tell me, oh, doc, my baby died because I don't have money to go for my ANC. I couldn't do this. Because no, I don't want to listen to that. First of all, you have to plan ahead on time if you're going to be pregnant, because pregnancy is expensive. My people, becoming pregnant these days is like going to Mecca, you know, getting a very difficult thing. It's tough. So when you become pregnant, protect your family, protect your baby, invest in this pregnancy, ensure your pregnancy, be wise, be careful, ask questions. You don't just go start doing things the way you used to do it. No, before you eat it, think about what you're eating. Before you drink only water. You avoid your alcohol. You be careful. You exercise. You eat good food, because you're carrying a precious angel in your body. Let's get it right this time. My prayer and what I believe, and what I'm telling you, it's just the way it is. There are so many people that will have positive pregnancy tests in the month of September. There are so many women that will be shopping for money for IUI, IVF, adoption, surrogacy, and suddenly Mercy will say no. Suddenly you will miss your period. Suddenly you're pregnant. Suddenly it has happened before. So regardless of where you find yourself, regardless of the cause of infertility, regardless of how long you have been, I don't care if it's 20 years, I don't care if it's 15 years. We have seen women that were looking for babies for 15, 20 years, and suddenly they became pregnant. Why? Because they were practicing their PPP. God is the only person that will decide to multiply your one egg into many. God has done it severally. But you need to be in the arena of blessing when God shows up. So let's do our own part. Now, when you show up in social media, be careful. Mind where you spend your time and money and data on. Some of you spend your money, data, and time on things that don't matter. Now, by the time you find things that matter, you begin to complain. Have a budget for September. If you are looking for a baby, 99.9% of your budget in September should be to infertility treatment. Not to Ashebi, not to car, not to big houses, not to, go and be looking for people you will impress. Are you not tired? So let's get it right for the month of September. Make it a September to remember. By September 2022, write this down. All the babies you are believing God for will come. Your twins will come. Your triplets will come. Your quadruplets will come. I'm not saying this because I'm a preacher or I'm whatever. I'm saying it because I know. So step up into your faith and reclaim your possession. Thank you for coming. Make sure you join Dr. Ndiche in a few minutes' time for her clinic. And make sure you reach out and wish her all the best. I love you guys. Tomorrow is our 40th Friday. Don't miss our 40th Fridays for anything. It's going to be the first. We're going to find a good topic and we're going to keep talking about it. Now, let me tell you, so long as God give me life, every single day I wake up, I will stand with women. I will stand with babies. I will continue to do my best until the very last woman is pregnant. Thank you for joining our community. Thank you for coming to this afternoon's clinic. I'll see you guys tomorrow. Until I see you, God bless you and bye-bye.